Hey guys, welcome back. This week we're going to be talking about gassiness in babies. So after last week's video, I received an anonymous request. We have a 5-week-old and we are dealing with breastfeeding. It has gone very well. Baby's growing, mother has enough milk, but dealing with a gassy baby. Everyone has gas. Babies, kids, adults, your grandparents. I have gas, and I know for sure that you have gas too, don't lie. Even animals have gas. It's to be expected, it's normal and necessary, really. But when it starts to cause discomfort, there might be an underlying reason. First, to know that it's actually gas, you should evaluate what your baby's doing. A lot of times, babies who have gas can have reflux, which is when they spit up quite a bit. Another thing is that they could be pulling their knees towards the chest multiple times. And that's them trying to get the gas to really move along down and through the intestines. And one way that I really like is you take the baby and you tap the belly, not hard, but if it sounds hollow like a drum, then that's gas. Most of the time, if it is a food reason, dairy is the culprit. That means milk, yogurt, cheese, even ice cream, all those good things. However, other common ones can be wheat, corn, fish, eggs, and even peanut butter. If anyone in your baby's family has a food allergy, such as a grandparent, an aunt, an uncle, a cousin, but especially if it's the baby's parents or siblings, then you shouldn't underestimate that food could be possibly the issue. Lots of people think that foods that give us gas, such as broccoli and cabbage, will make the baby gassy, but recent research has actually shown that doesn't pass through the breast milk. So though they could be options, they're not very high up on the list. In the end, it really could be any food. It's just taking a stab in the dark. To test out and see which food is causing baby discomfort, I recommend that you stop eating one food and see what the baby's temperament's like after about a week. And it will take a few days for you to see any changes, but if the temperament gets better, then you found it. It's done. But if it doesn't, then you should try another food and see if that does any difference. You can repeat this process over and over again until you find out what's causing your baby that pain. If your baby seems very irritable, then I would suggest actually going to your pediatrician. You can always talk to them, call them up, and just see what they have to give for advice. A reason that your baby could be gassy that is not food related is an improper latch to the breast or to the nipple of a bottle. When this happens, baby ends up drinking the air. Having a forceful letdown can also be a problem because the baby's getting too much fore milk and not enough hind milk. So if you think any of these are actually the issue, I would highly recommend talking to an IBCLC. They are amazing at what they do. That is their sole purpose, is to help breastfeeding mothers. And there's nothing I can think of that they can't help you with. So even like this gassiness, if you think it's a food item, they can help you. If you think it's a latch problem, if you think that it's anything, they can help you. That's what they do. They are a fantastic resource to have on your breastfeeding journey. Now we're going to switch views for just a moment so I can show you how to help your baby feel a little bit better when they're having these pains. This is my daughter Sophie. She's going to be our little model today. To help the baby handle their gas pain, something that you can do is you can pedal their feet just like this, as if they were riding a bicycle. And Another technique is you can just use both feet, push them up here, and release. You push them up, hold, release. Most babies, I find, though, like the bicycle movement. Though both of those methods are really good to do and they can be done anywhere, my personal favorite is to actually take the baby into the bath. So whether you want to just give them a bath by themselves, or what I like to do anyhow is to bring the baby into the bathtub with me. I get in the tub and have my partner give me the baby, and I wrap the baby up with a nice little washcloth, and I take a cup and I just pour the warm water all over the body. And my daughter, she'll lie like that for hours, even when she's super fussy, and she was colicky, but she would just lie there and she would just be so happy. And I loved it, and it was a great bonding moment. Even my other kids liked it when they were having little tummy problems. If you like this video, please give me a thumbs up and don't forget to subscribe and share, share, share. I know you know somebody who's pregnant or is a new mom. So share it with them. Let them ask questions. Let me help them. Write in the comment section below how you help your fussy baby. Or you can also ask a question for me to answer next week pertaining to pregnancy, birth, or parenting. Well, until next time, I hope you guys have a safe week. Take care now. Bye!